Hey everyone, and welcome back to my channel Physiosaurus and to the very first episode of our clinical case study series. In this today's video, I am going to walk you through a complete case of cervical spondylosis right from the assessment to the rehab. The goal of this series is quite simple. I'm going to train your clinical mind and not just to treat, but I want you to think like a physiotherapist. The video will be packed with clinical reasoning, practical physiotherapy, and some insights that will surely help you whether you are a student or a practicing clinician. So let's get started. Okay, so let me give you a brief intro about the case background. Okay, so a patient, let's say the patient name is XYZ and her age is 63 years old. Okay, so a female patient of 63-year-old came to a physiotherapy OPD from the neurosurgery department with the complaint of pain in her neck, which was radiating towards her right shoulder with tingling sensation felt in her hand sometimes. Now, here in the case background only, there are few things that you need to note down. First thing is patient age is 63 years. Patient's gender is female. Okay. Patient had a complaint of pain in her neck, which was radiating towards her right shoulder with tingling sensation felt in her hand sometimes. कुछ वर्ड यहाँ पे आया है जैसे कि रेडिएटिंग पेन. All right, radiating pain. The next word is tingling sensation. Radiating pain, another name for radiating pain is neurogenic pain. Why do we call it neurogenic pain? Because, of course, when the pain is radiating, that means there is some kind of nerve involvement. All right, tingling sensation once again indicates that there is some kind of nerve involvement. So, from the case background only, there are few things which are clear. Okay, the next thing. Now, as a physiotherapist, what will be the first thing that you will do? You will start taking the assessment. Okay, so first there is subjective assessment. In the subjective assessment, it includes your demographic data, then history, all right, all of these things. Chief complaint, okay, all of these things. So in the subjective assessment, I have kept the name of the patient anonymous. So the name is XYZ, age is 63, we already know that, gender is female, address is XYZ, not relevant here right now. Occupation is housewife, dominant hand is right hand, and date is XYZ, once again not relevant right now. Okay, chief complaint. Patient came with a complaint of neck pain from 5 to 6 months. You need to note down the duration. Duration is 5 to 6 months. So from the duration, it is clear that it is chronic. All right, it is chronic. So the complaint is of neck pain once again, and it has become worse in the last 10 days. The pain from her neck began to radiate into her right shoulder with the tingling sensation felt in her hand sometimes, which made it difficult for her to do her basic activities like looking up and down or turning her head sideways. Okay, so basically, due to the pain, patient is not able to do her basic activities. So, first thing, okay. Second thing, we already know pain is radiating from her neck and to her right shoulder with the tingling sensation felt in her hand sometimes. Okay, so there are few things that you can conclude right now. So in the examination part, we can do upper limb tension test. So there, if there might be some kind of nerve involvement, वहां से clear हो जाएगा. Okay, तो कुछ चीजें अभी clear हो गई हैं. History of the present illness. So patient has been experiencing this neck pain from 5 to 6 months. We already know. She visited XYZ hospital, not relevant right now, where she was diagnosed with cervical spondylosis. Cervical spondylosis को मैं एकदम जेनरिक भाषा में अगर मैं समझाऊं तो स्पाइन का osteoarthritis. So this is cervical spondylosis. Okay. And then she received the treatment for the same. Okay. Her pain was initially relieved by the medication, but after few days it started all over again. She then came to physiotherapy OPD after being referred from the neurosurgery department. So she was referred from the neurosurgery department, all right, for physiotherapy. क्या है, शुरुआत में उन्होंने दवाई खाई, बट कुछ दिन तक ठीक भी रही दवाई से, बट आफ्टर फ्यू डेज स्टार्टेड अगेन. ओके, तो इनका ट्रीटमेंट भी चला. अब ये दवाई क्या क्या खाई हैं वो हम लोग आगे चल करके समझते हैं. ओके, past medical history is clean. There is no sign of BP, diabetes, or any kind of traumatic history. There is no significant family history as well. Personal history. So personal habits, non-alcoholic, non-smoker. Okay, appetite is good, and she is a strict vegetarian. Okay, and her sleep cycle is disturbed, which is due to the pain. Okay, which is very obvious. दर्द अगर बहुत ज्यादा होगा तो सोने में दिक्कत होगी ही होगी. Okay, so the next is socio-economic history. Now, according to Kupuswamy scale, in Kupuswamy scale, there is a score between 3 to 29. Okay, 3 to 29. So, according to that Kupuswamy scale, patient belongs to lower middle class family. All right. Next comes the medical history. So, these are the four tablets that has been prescribed to the patient. BD means twice daily, OD means once daily. All right. Now, the next one is pain history. If I will talk about the tablets, now the Zerodol P is a painkiller, Pregabid is for the neurogenic pain, Pantop is for GERD or acidity. All right, and Tolperitas is actually muscle relaxant. Muscle relaxant. Pregabid is for neurogenic pain. Neurogenic pain. And Zerodol P is just a painkiller. All right. Now, the next one is pain history. Onset is gradual. We already know that. Location, you can guess neck, upper back, right shoulder, and hand. Duration is chronic. We already know that. Quality is persistent pain. You can guess that actually. Okay. Aggravating factor is movement. Obviously, when the patient does the movement, the pain increases. All right. And relieving factor is rest and medication, which is according to the patient and not according to me. All right, radiation is to the right shoulder and hand. Next one is pain disability index. Now, why is this important? Why pain disability index is important? First of all, let me tell you the score. Score is 47 out of 70. Now, let me tell you the relevance of pain disability index. For that, I will have to move to the chief complaint. Now, the patient's chief complaint was pain from her neck began to radiate into her right shoulder with a tingling sensation felt in her hand sometimes, which made it difficult for her to do her basic activities like looking up, down, turning her head sideways. तो क्या हो रहा है, दर्द के कारण पेशेंट को डिफिकल्टी फील हो रहा है बेसिक काम करने में जो पहले नहीं होता था. और वो बेसिक काम क्या है, ऊपर नीचे देखना या साइडवेज देखना. अब पेन डिसेबिलिटी इंडेक्स पे आता है. पेन डिसेबिलिटी इंडेक्स इसलिए इंपॉर्टेंट है क्योंकि जितना ज्यादा इंडेक्स होगा वो दिखाएगा कि उतना ही ज्यादा पेन का इंपैक्ट है पेशेंट का एबिलिटी टू परफॉर्म एडियल, यानी कि पेशेंट जो एडियल परफॉर्म कर रहा है उस पे पेन का कितना इंपैक्ट है वो दिखा रहा है. तो जितना ज्यादा स्कोर उतना ज्यादा इंपैक्ट. ओके, सो हायर द इंडेक्स द ग्रेटर द person's disability due to pain. So this is why pain disability index is important. Next one is on observation. Body build, mesomorphic, posture, right shoulder drop, cervical hump, scapula protracted. Now you need to note down all of these things because our rehabilitation protocol will be based on all of these things. General condition is poor, mode of ambulation is independent. What does ambulation means? Ambulation means movement, and this is why ambulance word came into existence. So ambulance means moving care. All right. Now the swelling is absent, scar is absent, so there is no need to worry about that. Next one is on palpation. So there is hydrated skin, skin temperature is normal, but there is grade 2 tenderness in the upper fiber of trapezius, right next to the neck region and on the lateral aspect of shoulder. Can you tell me all the grades of tenderness? Actually, I have discussed the grade of tenderness in my orthopedic assessment video. Orthopedic assessment video. In that video, I have discussed what are the data you need to take from the patient to complete your assessment. All right. So you can just go and watch that video. I'll just give that link in the description box. All right. There is also muscle tightness. Along with that, edema is absent. All right. That we have already discussed. Now there is muscle tightness, mild in upper trapezius and middle deltoid in the right side and pectoralis muscle in the right side. ऑलराइट. ऑर्थोपेडिक असेसमेंट के ऊपर जो वीडियो है ना वो आप लोगों को जरूर देखना चाहिए क्योंकि उसमें ना मैंने एक आपको एक पूरा प्रोटोकॉल दे दिया है. एक तरह से आप ऐसा समझिए कि आपको एक ब्लैंक शीट में जो जो चीजें भरना होता है, जैसे कि सब्जेक्टिव असेसमेंट में क्या क्या पॉइंट आता है, ऑब्जेक्टिव असेसमेंट में क्या क्या आता है, ऑन एग्जामिनेशन में क्या क्या आएगा, ऑन पाल्पेशन में क्या क्या चीजें आएंगी, तो वो सारी चीजें मैंने आप लोगों को एक एज अ नोट दे रखा है और उन सभी चीजों को मैंने डिस्कस भी करा हुआ है. वो लिंक मैं डाल दूंगा डिस्क्रिप्शन बॉक्स में. So now the next one is on examination. Now on examination, you examine two things, range of motion as well as muscle strength. All right, which is examined through manual muscle testing. Now about the manual muscle testing and about the range of motion, I have discussed both of these things and how to examine it in a separate video. I have already uploaded a video on MMT as well as goniometer. Okay, so you can watch this video on MMT and goniometer from the link given in the description box. Okay, so right now I'm not going to discuss how do you measure range of motion and how do you measure the muscle strength. So we'll directly talk about the examination part. First, we will examine the active range of motion of neck. So for the neck, flexion is 0 to 15 degrees, extension is 0 to 40 degrees, lateral flexion is 0 to 30 degrees, lateral flexion is 0 to 30 degrees again for the right and left. Rotation for the right is 0 to 25 degrees and for the left is 0 to 50 degrees. Can you tell me what is the normal findings? What are the normal findings for neck range of motion? Okay, can you tell me in the comments? Let me know. Okay, the next thing is shoulder active range of motion. For flexion, it is 0 to 120 degrees. For extension, 0 to 30 degrees. Abduction, 0 to 130 degrees. Internal rotation, 0 to 65 degrees. And external rotation, 0 to 80 degrees. Once again, tell me the normal findings for shoulder active range of motion. Let me know. And also let me know which muscle is involved in shoulder flexion, abduction, internal rotation, and external rotation, as well as neck flexion, extension, lateral flexion, and rotation. Let me know in the comments. Next thing is manual muscle testing. So for the neck flexion, it is 3. For neck extension, it is 2 plus. Lateral flexion, 2 minus bilaterally. For shoulder flexion, it is 2 plus. For shoulder extension, it is 3. For abduction, it is 2 plus. For internal rotation, it is 4. And for external rotation, it is 4 again. So this is the data for manual muscle testing. So from this data, you can understand which muscle needs to be strengthened. Okay, lateral flexion को strengthen करेंगे, नेक एक्सटेंशन को स्ट्रेंथन करेंगे, शोल्डर का फ्लेक्शन को स्ट्रेंथन करेंगे. ठीक है, ये सारी चीजों पे हम लोग काम करेंगे धीरे धीरे. abduction को भी हम लोग उस पर भी काम करेंगे. ठीक है, ये सारी चीजें. Dermatomes and myotomes, it is intact. Now here comes the special test. Compression test is positive, distraction test is negative, upper limb tension test for median nerve is positive, for radial nerve is negative, and ulnar nerve is negative. Now, here is a special thing about special test. Special tests are not so reliable. Okay, these are not so reliable. Why? Because there are two things that you need to keep in mind while performing a special test. So the two things are sensitivity, and specificity. Specificity. So to understand this, I have uploaded a post on my Instagram. Basically, I will upload a post on my Instagram and I will make sure that you learn about the sensitivity and specificity. So from now on, when you are performing the special test, you should keep these two things in your mind. Right now, I'm not going to discuss it. I just want you to know that special tests are not so reliable. Okay, but as a physiotherapist, you perform it anyway. Okay, am I suggesting it? You can do it unless and until it is not uncomfortable for the patient. Okay, if it is uncomfortable for the patient, stop doing it. Okay, so after the special test, here comes the radiographic imaging, which is nothing but MRI of cervical spine. So in the MRI of cervical spine, there is two main findings. First one is loss of cervical lordosis, which means there is flattening of cervical spine. And then the second point is spondylotic changes are seen. That means spondylotic changes means degenerative changes. All right. So spondylotic changes are seen in cervical spine with disc desiccation changes at all the levels and marginal osteophytes with mild reduction of disc heights at multiple levels. तो हर एक लेवल पे मल्टीपल लेवल मतलब कि C1 से लेकर के C7 तक मल्टीपल लेवल्स पे जो डिस्क का हाइट है वो कम हुआ है. साथ ही साथ मार्जिन पे ऑस्टियोफाइट्स भी हैं और उसके साथ साथ देर इज डिस्क डेसिकेशन. डिस्क डेसिकेशन मीन्स डिजनरेशन ऑफ वर्टिब्रल डिस्क. ओके, तो ये सारी चीजें हैं. सो दीज आर द फाइंडिंग ऑफ MRI ऑफ सर्वाइकल स्पाइन. Next one is functional evaluation, which is related to ICF, International Classification of Function. Okay, I have already uploaded a video on ICF. I will provide that link in the description box. A must watch video for all the physios out there. Very, very important if you are a student. Okay. So in functional evaluation, we will evaluate three things: problems list, activity participation, and participation restriction. First thing is problems list. So patient identified problem is difficulty in doing ADL like cooking food, chopping vegetables, bathing, combing and other activities that involves neck bending. तो जितने भी एक्टिविटीज हैं जिनमें नेक बेंडिंग इन्वॉल्व होता है उन सभी में प्रॉब्लम हो रहा है। खाने पकाने में भी प्रॉब्लम हो रहा है, सब्जी काटने में प्रॉब्लम हो रहा है, नहाने में दिक्कत हो रहा है, कंघी करने में दिक्कत हो रहा है। ये सारे पेशेंट आइडेंटिफाइड प्रॉब्लम्स हैं। कुछ ऐसे भी प्रॉब्लम होते हैं जो कि नॉन पेशेंट आइडेंटिफाइड होता है, यानी कि पेशेंट उनको नहीं कहता है बट वो इंपॉर्टेंट भी है, वो एक तरह का प्रॉब्लम है, जैसे कि पोस्चर का बिगड़ जाना या फिर मसल स्ट्रेंथ का रिड्यूस हो जाना। सो दीज आर सम ऑफ द नॉन पेशेंट आइडेंटिफाइड प्रॉब्लम्स। Second thing is activity limitation, which is bathing. Participation restriction is preparing meal and house cleaning. So these are all the participation restriction. अब आप बोलोगे कि ये सारी चीजें आई कहाँ से? ये सारी चीजें आपको पहले ही गेस कर लेनी चाहिए जब मैंने कहा that patient is 63 years old and she is a housewife. ओके, हाउसवाइफ। तो अगर वो हाउसवाइफ है तो प्रॉब्लम का लिस्ट उसी से रिलेट करता हुआ होगा, एक्टिविटी पार्टिसिपेशन भी उसी से रिलेट करता हुआ होगा। तो ये क्या है कि आप जिस तरह से एक चेन होता है ना, जिसका आप एक छोर अगर आप पकड़ लो, लेट्स से दैट दिस इज द चेन, तो अगर आप एक छोर अगर आप पकड़ लो तो दूसरे एंड तक आप पहुंच ही जाते हो। तो सेम इसी तरह से आपके पास थोड़ा थोड़ा डेटा था, वो कर उसको आप इकट्ठा करते 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 आप नेक्स्ट तक, मतलब लास्ट तक आप पहुंच गए। ठीक है, तो आप अपना दिमाग इस तरह से आप लगा सकते हो। द नेक्स्ट वन इज आउटकम मेजर्स। इन द आउटकम मेजर्स वी यूज द neck disability index and in that the score was 34 out of 50. Okay, yellow flag. What is yellow flag? So patient had fear of surgery, that whether she will be able to recover or not, and will she be able to perform her ADL activity without pain or not. So this is the yellow flag. Okay. Next is medical diagnosis. Now here is the final diagnosis. So the medical diagnosis is cervical spondylosis, which is very obvious. You already know that. But as a physiotherapist, what would be your diagnosis? Now, as a physiotherapist, your diagnosis will be impaired joint mobility of cervical spine associated with function limitation as well as pain. So, this is your diagnosis as a physiotherapist. So, now you will work on joint mobility of cervical spine, you will work on pain, you will work on functional limitation. So, these are the three things that you will work on. And now we have reached the end of the slide. So the end of the slide includes the physiotherapy goals. Now you must be wondering that how would you decide physiotherapy goals? So it is decided according to the patient. Okay. So physiotherapy goals is of two types. First one is short-term goal and the second one is long-term goal. Short-term goal includes, in this scenario, I'm talking about this scenario. So short-term goals भी आपको patient ही बताता है. Let's say patient जिस पे सबसे ज्यादा फोकस करे, जिस पे सबसे ज्यादा emphasis दे, जिस पे सबसे ज्यादा प्रेशर दे, ठीक है, कि भाई मुझे पेन बहुत ज्यादा हो रहा है, या मेरा हाथ नहीं उठ रहा, या मेरे से वो काम नहीं हो रहा, फिलहाल मुझे ये होना है। ठीक है, तो वो हमारा हो जाता है शॉर्ट टर्म गोल। अगर वो बता रहा है कि पेन बहुत ज्यादा है तो पेन को सबसे पहले हम लोग रिड्यूस करेंगे एज अ फिजियोथेरेपिस्ट। सो दीज आर द शॉर्ट टर्म गोल्स। लॉन्ग टर्म गोल क्या है कि पेन को घटा दिए, अब वो पेन दोबारा ना हो। ठीक है, तो उसके लिए हम लोग क्या कर सकते हैं? सो दिस इज द लॉन्ग टर्म गोल। ठीक उसी तरह से रेंज ऑफ मोशन तो बढ़ा लिए, ठीक है, अब वो रेंज ऑफ मोशन मेंटेन्ड रहे, उसके लिए हम लोग क्या करेंगे? मसल स्ट्रेंथ को तो बढ़ा लिया, अब वो मसल स्ट्रेंथ मेंटेन रहे उसके लिए हम लोग क्या करेंगे? सो दीज आर द डिफरेंस बिटवीन शॉर्ट टर्म एंड लॉन्ग टर्म गोल. So in this case scenario, short term goal includes reduce pain, improve range of motion, improve muscle strength, improve patient education, not improve but create some sort of patient education, tell them about their condition, symptoms and everything. Okay. Self management, and advices. For the long term goal, it includes maintaining that range of motion, maintaining that muscle strength, making patient functionally independent to perform medial activities. Once again, patient education, which is very, very necessary. Fifth one is self-management or advices. And the sixth one is ergonomic devices. Now that you have known every single thing about the patient, you let me know what are the exercises that you will prescribe as a physiotherapist to this patient in the comment section. All right. Obviously, I'll make a next video on the physiotherapy intervention part, but now I want to know what are the exercises that you will perform, you will prescribe as a physiotherapist to this patient. All right. So bye bye, take care, and thank you so much for watching this video. Meet you in the next video where I will talk about the physiotherapy interventions.